People ask me, Prabhu, in IS, RM or STEM, then you are surrounded with all beautiful.
That's true.
It's a disclaimer.
Even though I'm a gynecologist myself, I practice modern evidence-based medicine.
What actually happens inside the ovaries in the aging part? Like we'll talk about when they age.
Whenever ovaries start aging, that is when the mitochondria of the ovary, they start decreasing.
Common myth about this menopause or the ovarian age decline.
First and foremost and most important is that ovaries will only decline after 35.
That need to be changed.
No, that's not true. Your ovaries are aging throughout your life.
30s or 40s,
Yeah.
when they should go for this egg freezing?
Ovaries age the fastest after 35.
Hello friends, today I am speaking with one of the renowned gynecologist and fertility specialist, Dr. Utkarsha Agarwal, gynecologist at Rabi Women's Hospital, Noida, Uttar Pradesh. She is a recurrent pregnancy loss expert, dealing the cases with the low AMH, premature ovarian failure, and leading regenerative medicine expert. Welcome you, Dr. Utkarsha, today in our episode of ovarian aging and their management with recent advances in the science of longevity and regenerative medicine.
Thank you so much for the kind introduction, sir.
So as we all know about, and this is the hot topic these days, the ovarian aging, a big challenge, definitely, especially if we'll talk about from the age of early 30s or late 20s to till menopausal states. If we'll talk about like premature ovarian failure or the primary ovarian insufficiency and so-called ovarian aging, what's the major cause for that and what's the lifestyle it's getting affected with this?
Okay, so let's talk about the basics. So I hope everybody has watched Bigg Boss. So imagine every year you see lots of contestants who are queuing up, and ultimately there is just one person who gets the prize. Similarly, our ovaries are having lots of eggs, and I mean millions of eggs. So when a female is in her mother's womb, at 5 months of age, she's having maximum number of eggs. From that point onwards, her ovaries start aging. So by the time a girl is born, she will only have about 1 million eggs to 2 million eggs maximum. And by the time she reaches puberty, that time she will have about 300,000 to 500,000 eggs. So ovaries are aging continuously throughout the life. That is one organ which ages continuously. So yes, that's biology. But knowing that helps us to determine what we can do to slow down this process, what we can do to preserve our fertility. So we have a lot to talk about that.
So ovarian health, directly connected to the ovarian aging, if we talk about the metabolism, energy, cognitive health, how it's directly connected with that?
So I think that's a very interesting question. A lot of people associate ovarian aging and ovarian health with only fertility. Now that's not true.
Yeah, they talk about the hormones.
Yes. That's
definitely.
absolutely so important, because ovarian health not just affects your fertility, it affects everything else in your life. It affects your metabolism, it will affect your cognitive, your behavior, it will affect your mood swings, it will affect your bone health, joint health, heart health, everything. So ovarian health actually affects everything else for a female. But a lot of people don't know about it. So whenever a woman ages, so whenever she reaches about 30, 35 years of age, her ovaries start functioning less, that is the time.
What's the first signs?
So let's talk about it. So first sign would be that her cycles would start shrinking. So normally, if you have a cycle of say about 4 or 5 days, your cycles will become lesser. So you will have bleeding for about 2 or 3 days. That is the number one sign when you should actually go and see a fertility specialist. And I say this all the time to all my patients, that whenever you see that your cycles have become shorter, they have become shorter as compared to what they were earlier. Now, this is different for everyone.
Very
So,
true.
whenever they become lesser in the duration, that is when you should actually get yourself
Very true.
investigated. So, I think this is very important point.
So primary thing, like once the cycle gets shorter and you do all the scans and the gynecological
Yes,
examination.
that's the time, that's the first bell that you need to press this. Okay, I need to see my gynecologist.
Very
I
true.
need to go and see either Dr. Prabhu Mishra or Dr. Utkarsha Singh.
I'm not a gynecologist. I'm not a gynecologist, so they cannot come to definitely the Dr. Utkarsha. So what actually happens inside the ovaries in the aging part, like we'll talk about when they age, especially in the hormonal changes. What do you think? Like scientifically, mechanism of action, or for the like non-medicos and non-medicine person or the health enthusiast, how the ovarian aging's mechanism works?
Okay, so this is very interesting actually. So nowadays we have heard a lot about reactive oxygen species, we have heard a lot about antioxidants and all of those things. Now nobody knows what is happening. Everybody is just prescribing those
mitochondrial
things.
decline,
Yes.
etc.
So that is what is happening. I want to tell this today, that whenever ovaries start aging, that is when the mitochondria of the ovary, they start decreasing in
And
their
that's the
function.
powerhouse of the...
That is the powerhouse of the cell.
Yep.
So mitochondria produces something called as ATP, which is basically cellular energy. So like we have Indian INR, rupee, that is what we spend. Our cells are able to spend energy only in the form of ATP. So ATP is the currency of the cell. When you don't have the ATP, you're going to be poor. Similarly, the cells are going to be poor. That's what is happening. So whenever the cells
they are leading to the inflammation, the new terminology these days, inflammation and the faster aging.
Yes, that's very true. So it's inflammation followed by aging. So whenever mitochondria start to function less, they have more inflammation, they have more reactive oxygen species, they have more of oxidative stress. And imagine you still have those eggs that you were born with. And whenever those eggs are going to have more of oxidative stress, that is when the actual ovarian aging would kick in.
And do you think it's affect the brain health or the cognitions?
Oh, absolutely. I cannot emphasize it enough. Whenever there have been studies, there have been studies that PET scan shows that whenever estrogen dips, there have been cognitive decline, there has been less glucose intake. So estrogen not only helps you with looking beautiful, looking glowing, and but it also helps to keep your brain sanity in place. So that's what estrogen does. A lot of women in the menopausal age group, after their periods have stopped, develop Alzheimer's. So cognitive brain function declines. They're going to have brain fog. They will have trouble remembering things. That's all a sign of estrogen deficiency. That all stems from ovarian aging.
Yeah, and anyways, we all know, like, progesterone is the first hormone which goes in early 30s or the late 20s, and then the estrogen declines. So definitely, and apart from this cognitive or the brain health, any concern of the ovarian aging with the heart health or the cardiac health or the hormonal health?
Yes. So whenever, till the time a woman bleeds, that's like a goddess. We always, in Hindu mythology, we are praying to goddesses. We worship goddesses. What is happening? Because whenever a woman is bleeding, that is the time her heart is protected. Because whenever she is bleeding, that means her body is producing estrogen. That means her body is producing more eggs. And that is why her HDL levels, which is good cholesterol, that stays up high. When she stops bleeding, the HDL drops. And the LDL, that is the bad guys, they move up. That is what is happening at heart health.
At the menopausal state, basically.
That is happening at menopausal state. So it is very important for women to actually preserve their hormones. It is important that they work on themselves to preserve their hormones and retain their youth. Not just in terms of how good they look, not just in terms of how less wrinkles they have, not just in terms of how youthful they look, but also in terms of how healthy they are, in terms of heart health, bone health, joint health, and mental health as well.
Apart from this, like you nicely mentioned, for the cognitions and the heart health, bone health, especially if we'll talk about the bone and joint or the musculoskeletal, how it affects?
So what happens is estrogen is required for your bones to store calcium. This is one thing that not many people know. Estrogen is actually required for your bones to store that calcium. So whenever a woman again reaches a menopausal state, the calcium declines in bones, the bones become weaker, she will be prone to all sorts of fractures. So the moment you have a fall, you will have a fracture. That's what is
So in
happening.
that case, can we supplement calcium standalone these days, or like calcium is obsolete, or we should go with the D3, K2 and magnesium? There are various debates these days. So
Yeah.
what's your comment
So
on that?
that's now that's coming to nutraceutical part. So yes, definitely calcium is one supplement that we need to give because the body is not able to absorb so much of calcium naturally. So we need to supplement it. Also magnesium, vitamin K and all of those things, they definitely help.
Yeah, because like if we'll talk about especially the D3, standalone D3 is nothing.
Yes,
It's
absolutely.
So because
true.
we need the magnesium, to carry them, and then K2 to maximum absorptions.
Absolutely.
So what should be the ideal doses if any women, those who are were like moving towards the menopause or perimenopausal state, or even the early who are premature ovarian failure cases, do you recommend D3, K2 and magnesium?
Absolutely. I give it to all my patients who come with poor ovarian reserve. Nowadays, I'm telling you, I'm seeing so much of cases of low AMH. People are coming with poor ovarian reserve as early as 25 years of age, which we have never seen earlier. They're coming as early as 25 years. Earlier, we used to see those cases at 35, 40. Nowadays, we are seeing it at 25. So there is a nutritional deficiency, definitely. People are partying up late. That's not a debatable thing. But still, whenever you party a lot, you party hard with hard liquor and also it affects your gut.
Lifestyle
Factors usually. We are not getting up early, so we are not getting any sun. We are sitting in a 9 to 5 job or probably even late. We are sitting on a desk. We are not getting natural sunlight, so we are not getting anything that our ancestors used to get. So we need to supplement all of this now.
And what 5 key biomarkers you check for the faster ovarian aging or like a premature ovarian failure? Okay. As you rightly mentioned earlier, like first thing you see the shorter span of the cycles. Yes. Apart from that, if you'll see the diagnosis part, what key biomarkers you check?
So first and foremost, whenever I see a patient, there are certain things that I like to check. First, I will go for an ultrasound for her. So ultrasound is like my stethoscope. It is the new stethoscope for all the fertility physicians out there, because in an ultrasound, I'm able to see how much is the blood flow to each follicle, how many total number of follicles are there, how is the ovary size. So all this information I'm getting on my ultrasound. Number 2, and a very important marker, is an AMH.
Anti-Mullerian hormone.
Anti-Mullerian hormone. I think a lot of people have heard about it. Nowadays, a lot of companies are coming up with those fertility tests. But unless and until you go and see the interpretation with the fertility specialist, that test holds no value.
And any cutoff marker you consider, like AMH is such a critical factor because elevated in PCOS.
Yes.
And because it's 3 notorious diseases, PCOS to premature ovarian failure or the POI and the endometriosis.
Yeah.
All 3 are linked with the AMH.
Yes.
So what's the key differentiation pattern? How you
do? For anyone who's planning their AMH, who's had some danger signs and they're planning their AMH, this is for everyone. Normal, if your value comes under say about 2.25 to 4, that is usually normal. And if anything which is more than 4, it usually is because of PCOS or endometriosis, something like that. And if it is less than 2, then you need to rush, because that is the time when your ovaries are starting to age.
And the third markers?
The third and very important one is day 2 FSH.
Very important.
Day 2 FSH is
follicular stimulating hormone.
Yes, FSH is follicular stimulating hormone, because FSH is like a bell. Whenever ovaries are not producing enough eggs, then FSH comes with a stick and it's like, hello, where are you? That's what FSH is.
So antral follicular count you see
Antral follicle count I'm seeing on the ultrasound. I'm seeing FSH with a blood test. So blood test and an ultrasound, that gives a complete picture of how the ovaries are looking.
And any other markers you check? ovarian aging,
Nowadays, we use less of other markers. There are other markers, of course. There's inhibin, there is clomiphene challenge test, and all of those things. But usually, the information that we get from all of these tests
3-4 are the
is
key
enough. Yeah.
biomarkers
Yeah,
which gives you the comprehensive idea about their
Comprehensive,
ovarian
yes.
health and their
Absolutely.
aging pattern. Very true. So now modern intervention, if we'll talk about these days, like we all know, like especially in this era of longevity, functional medicine and regenerative therapeutics or regenerative medicine, what's the recent advances you have seen in your practice or in this generations especially, because once they come up to the clinic, to the various so it looks like they have tried almost everything,
Yes.
IUI, IVF, multiple failures, so this kind of process, and they are carrying their hope like, oh, we are going with this kind of treatments, it will show the miracle.
Yeah.
So what modern like interventions you have tried, and what's your experience with that?
Yeah, so I think this is one of my favorite parts about this podcast, because this is a platform to educate people about all of these new therapies. So whenever I see that the patient has low ovarian reserve, obviously if you go to any traditional fertility clinic, you might go for a donor cycle. But I feel that whenever a woman is coming to me, she should get the chance to have a baby with her own eggs. That's my belief personally. So I always tell them that, okay, there is a chance that you might conceive with your own eggs without any external sources. I think that's very important. So I offer them a lot of therapies. First and foremost of them is nutraceuticals and lifestyle change. This is extremely
like which kind
important.
of nutraceuticals you recommend?
So before nutraceuticals, I usually tell them that first drug is your lifestyle change.
Very
So
true.
I always tell them that you have to follow a mnemonic which is called DEWS. So diet, exercise, sleep, and stress.
Very
These
true.
are 4 things that they need to follow. So diet has to be something which is rich in omega-3s, it is rich in antioxidants, green leafy vegetables, rainbow on the plate. And I am a big advocate.
Everything, it's in their hand. They are
Yes,
homemaker.
yes.
So they can make their plate very easily.
So
So,
even for working, nowadays
Yeah.
it's even more difficult for
yeah,
working
homemaker
women.
means it's not like that I'm differentiating like they are not working. Means ultimately women is the creator,
Yes,
either the home or the
yes,
life.
Yes, that's true. That's true. So
It's a disclaimer, like I'm not here talking the biased versus.
that's true. The feminist in me suddenly got...
No, it's like they are creator of the life. You
Yes.
know, people ask me, Prabhu, in ISRM or STEM, then you are surrounded with all beautiful. I said, women is the creator of life. So in ISRM, majorly it's run by the women because they are giving life to the ISRM.
Oh, that's wonderful. That's actually very beautiful. So I usually tell them this, that you have to follow rainbow on the plate, and I am a big advocate of natural healing. Even though I'm a gynecologist myself, I practice modern evidence-based medicine, but I am a big follower of Ayurvedic diet. And I always tell them that you should eat the way your grandmas used to eat.
It's in our blood. We have inherited from our generation and generations.
Yes. So I've literally grown up with that. So I always tell them, okay, that this is the portion of green vegetables, this is the portion of salad, this is the portion of proteins, this much carbs and all of those things. So I devise a diet
I'll tell
plan.
you one very peculiar story, because as we are talking, like cord blood banking came in late 90s, 96, 97.
Right.
First cord blood banking came as a public banking. I'll tell you about my grandmother, like obviously not from my birth, but what we heard and what they have told us as a story. वो लोग क्या करते थे, दे कटिंग द कॉर्ड एंड कीपिंग देम, जस्ट उसको अपने घर के लेंटर उंटर पे कहीं पे रख दिया, दे कीप लाइक दैट. एंड जब भी किसी को सर्दी खांसी हुआ, गेट दिस काइंड ऑफ कोल्ड एंड ऑल, जायफल एक होता है, सो जायफल एंड मिल्क, मदर्स मिल्क एंड द जायफल, एंड उस कॉर्ड को घस के जैसे 1 स्पून दे दिया. सो लाइक इन दैट काइंड ऑफ दिस ऑल सर्दी खांसी जितने भी कोल्ड कफ होते थे, दे वर डूइंग लाइक दैट काइंड ऑफ स्टेम सेल थिंग्स इन दैट without any invention. So like Indian diet and Indian mythology is like this way have
it was miles ahead.
Yeah.
I still feel it was miles ahead.
Imagine, like, we are born in 80s, and after that, like this thing, so it was really a shocking for me, like like when they told me like, अच्छा आजकल तुम stem cells करते हो, हम लोग ये
हम लोग
करते
ये
थे,
करते
तुम्हारे
थे।
करते हो, मतलब. So this was the really
That's
true
very
inspiring
interesting.
story.
Yeah, that's actually interesting.
So that's how.
Yeah, that's good.
So what's the, in your way now, let's continue, like
Yeah.
nutraceuticals is your first modern interventions. So
Yes.
among nutraceuticals, give the message to our listeners, what 4-5 key you are recommending to your patients.
Yeah. So, first and foremost, we have to take care of mitochondrial health. And for mitochondria, the number one antioxidant that we were just talking about is CoQ. It is very important.
So ubiquinol, basically.
Yes, that's ubiquinol. It's very important to give CoQ because that is something that is going to help produce more ATP, and it will help to reduce the oxidative stress that is stressing out all our oocytes. So we remove the stress from all our oocytes. We provide them with a stress-free environment. One thing is remove the stress from the external world, and this CoQ will remove the stress from their internal world. That's what this does.
Oxidative stress and the
yes,
stress.
yes. And nowadays we have a newer molecules. We have resveratrol, we have PQQ, we have NAD, we have NAC. All of these work in conjunction. Obviously, there is no single formulation. There is no single dose that will work like a magic drug. So nowadays,
very soon we are bringing, like, minarchy to menopause. We are jumping into this nutraceutical zone, along with the regenerative therapeutics, being the 20 years of regenerative medicine. We are coming into that as well to all assist.
So there is no magic drug. When people take these drugs, they expect that their AMH is suddenly going to increase from 0.5 to 2.5. No, that does not happen. We have to tell them, okay, this is the realistic thing. You take these supplements, you do your lifestyle changes, you do your exercise, diet and supplements and stress-free environments and all of those things, and still your AMH might not rise to that level. But yes, it will definitely affect your chances of getting pregnant. It will definitely increase your success rates whenever you're trying.
Glutathione is taken a leap for these days. Talk about the glutathione. They all talk of whitening and all, energy, this, that.
Glutathione facials. Yeah.
So along with this modern intervention nutraceutical, what any other things you do? Especially for the ovarian aging, if we talk.
Yes. So once I'm done with all of those things, first and foremost, I give them diet, lifestyle, exercise, the nutraceuticals. Apart from that, then there are people who are on the lesser side of the AMH. So the AMH is less than 0.5, less than 0.1. I get people like that as well. So for them, I have to take certain special measures. Now that is the time when I give them something more. And what more is something surgical, and that is therapies. So I have regenerative therapies. We give them PRPs, we give them stem cells, exosomes. All of those therapies are something that I usually give them. Again, not miracle
all
treatments.
autologous?
Autologous, all autologous.
That is the percentage itself a source.
Autologous.
So PRP, dear listeners, PRP is from your own blood carrying the healing cascade. They are taking the blood, centrifuging it and injecting. Dr.
Yes.
Utkarsha.
So why we do autologous in all of these patients is because it will not have the side effects. If we take it from some other person, there will be immunological side effects. When we are doing autologous, there are no side effects. Only surgical side effects, which are extremely, extremely rare. So I'll say about 0.01%. Till date, touch wood, I've not had a single complication. And I pray to God that let it be so.
Of course, this is fully safe.
Yeah, it's absolutely safe. So PRP is something very easy. You just draw like 20 ml of blood and you're able to prepare PRPs. And you just inject it into the ovaries. You can give multiple sessions or one session depending on how the patient is comfortable, what is the response, how much is the expected egg retrievals that you want, all of those things. So that determines number of sessions of PRP. And whenever I'm going for high-end therapy, suppose if the ovarian volume is also less. So I've had patient whose ovarian volume was less than 1 cc. Now it is this small an ovary. That is something, then you need to jump ahead. Now that is the time when you need to jump to something more, something like stem cells. So that really helps.
Yeah, it's a very fine line where to choose the PRP, where to choose the stem cells.
Yeah.
So, what kind of changes you observe after stem cells and the PRP? And do you select patients like it's a premature ovarian failure, it's a primary ovarian insufficiency, or it's a perimenopause or the menopause? At what stage you decide where to use PRP, where to use the stem cells?
So what happens is, now imagine that you suddenly change into Malaika Arora. That's what the ovary does.
Disclaimer, no name.
So, no, no names. Jokes apart. So, ovaries kind of rejuvenate. So, if somebody is getting a Botox treatment, it's similar to that. So, what happens in the ovaries, I've seen that if there is just 1 or 2 follicles in the ovary, it increases to about, say, 4 or 5. That's what I'm getting. More importantly, I'm seeing an increase in the quality of the eggs retrieved. More than the quantity, it's the quality that matters to me. Because I need to form their embryos, I need to give them pregnancy. That's where the quality of eggs matters more to me, and that is something I'm able to see. And it is very, very clear that whenever I am using stem cells, I have almost always seen an increase in their AMH, seen an increase in their follicle count, seen a decrease in their FSH. So if the FSH was very high, say about 40, 45, her FSH came down to like 11 or 12. So we have like solid data on how the stem cell affected their fertility.
Yeah, of course. I had even, like I'm doing a stem cells for years and years,
Yes,
and
yes.
trained more than 3,000 doctors across the world. So, apart from this regenerative therapeutics, you will talk about, as you mentioned, lifestyle changes.
Yes.
So, like sleep, stress management, nutrition, diet, how it affects the ovarian health.
So, I think
Or what kind of recommendation you give them for management of the faster ovarian aging?
So, I think the number 1 factor for ovarian aging is sleep. And I cannot emphasize it enough. If a woman does not sleep, her hormones are going to be all over the place. It will wreak a havoc there, because your circadian rhythm actually supports those hormones. Your melatonin production supports those hormones. And for those people who are having trouble sleeping, nowadays we add melatonin in their routine. We add melatonin at the bedtime so that they are able to sleep better.
And what dosage you give around?
2 to 3 mg is enough. Usually it's a very small dose that we need. That is enough. But that is what is actually the most important thing. First thing, foremost thing is sleep. So not just 6 hours, but you actually need 8 to 10 hours of sleep. For males, it's okay if they sleep for 6 to 8 hours. For like you hardly sleep, I know.
No, but sleep deprivation is always for the faster aging. Always, it's not a good recommendation for anyone. But sometimes,
Yeah.
we forget for ourselves what
If
we
you
are
work
doing.
like Dr. Prabhu, then obviously you might forget to sleep.
So,
We are not
from-
superhumans. You are superhumans.
No, none of them are superhumans, but we are living in the era of artificial intelligence, so we need to be little. So, speed should match with the sonorobotics. This is what I believe, and this is the one life.
Yeah.
And people talk about these days ovarian preservations, especially like oocyte preservation and all. Is this a recommendation or not? Like the way lifestyle we are living, women empowerment, career, everything. The era have completely changed. Lifestyle modification came, various things. So, what's your recommendation on the oocyte preservation or ovarian preservation?
So as I told you, I'm a big
The egg
advocate.
freezing, so-called.
Yes. So as I told you, I'm a big advocate of old Indian culture. I am an oldie at heart. But at the same time, I practice modern day medicine and I am a progressive woman.
But you are quite young, so...
And I am, that's what I told. I am a progressive woman. So I will not recommend anyone to leave their careers behind or, just not follow their dreams just because they have to get pregnant. So for them, I think ovarian preservation, egg freezing is a very good option. It's a wonderful option, I'll say. Because obviously it does not guarantee you having a baby, but it increases your chances. Did you know that a lot of celebrities are getting it done? We have a lot of celebrities who are getting it done. The reason being, they're not able to find their Prince Charming,
Right.
but they don't want to, yeah, they don't want to lag behind in their careers. And of course, they do understand that ovaries are going to age. There is a biological clock that will tick no matter how healthy you eat, no matter how good sleep you're having, no matter how stress-free your life is, which is a rarity, for to be very honest, but still, this is what happens. So nowadays, a lot of celebrities, a lot of educated people who do understand this, they're getting their eggs frozen. People who don't understand this, I will recommend that, okay, read about it at least. Do some chat GPT, do some Google Gemini AI or something like that, and then you will get to
And
know.
especially in 30s or 40s,
Yeah.
when they should go for this egg freezing.
So, did you know that ovaries age the fastest after 35?
Very true.
Between 20 to 30, the ovarian aging is the slowest. So we cannot alter the fact that ovaries are going to age, but we can alter the rate of growth, the rate of aging. That is what we can alter. So the ideal time, if you talk about, is about 28, 29. That is the time when your
Yeah.
ovarian aging is the slowest. But let's be honest, even we did not know it when we were 28, 29. So whenever you feel is the right time, that is when you should do
Very
it.
true. Very true.
Better late than never.
Or they marry early. Or they have the child early.
Or have the child early.
Very true. What are some common myths about this menopause or the ovarian age decline? In the rapid fire like this way.
Lots of myths. First and foremost,
And that need to be changed.
yes, that absolutely needs to be changed. First and foremost and most important is that ovaries will only decline after 35. No, that's not true. Your ovaries are aging throughout your life.
Yeah.
You cannot stop it. You can definitely decrease the rate, but you cannot stop it. Second most common thing that I hear is, okay, this my cousin or my friend or somebody, she had a baby at 40. Why can't I conceive at 30? Again, very common, because ovarian aging is different for every different person. It's
True.
not same for everybody. So a 37-year-old can have an ovarian age of 32, but a 32-year-old can have an ovarian age of 40. That's
Very
very true. So that is something that we need to teach people.
Very true. Very true. Such a wonderful discussion, Dr. Utkarsha. Ovarian health, it's one of the amazing topic today we have discussed here with Dr. Utkarsha Agarwal. Mesmerizing outputs for our audience. Ovarian health is much more than the fertility. This is what we believe. It's a reflection of how the whole body ages. So this is one of the key parameters in today's discussions. The exciting part is science is giving us tools to understand and even slow the process.
True.
Especially the stem cells, PRP, exosomes, and many other regenerative therapeutics and the holistic approach, diet, stress management, nutrition. This was the key parameters today in these discussions. Thank you, Dr. Utkarsha, for joining me and sharing such valuable insights. And to everyone listening, stay curious, stay consistent, and keep biohacking your age. I'm Dr. Prabhu Mishra, and this is the AgeHackr. And please follow, subscribe, AgeHackr.
Thank you so much for having me here. It was wonderful to be present and wonderful sharing all these insights and outputs with you, sir. Always a pleasure.
Thank you. Thank you so much, Dr. Utkarsha.